Euthanasia, legalizing physician-assisted suicide. Euthanasia is an act to end one's life, one that is fatally ill or lacks the quality of life. Those within their last stages of life should be able to die with their dignity still intact when a quality of life is no longer in existence. Euthanasia should be used to aid in the death of those who want to end their suffering. The legalization of euthanasia can allow those in the last stages of their life to leave with dignity, as well as leave with what's left of their quality of life. Everyone has family members that are terminally ill and have fatal conditions that are struggling every day to survive. Euthanasia can let the terminally ill be at rest. As someone who is pursuing a career in the medical field, I see firsthand the devastating effects that having a poor quality of life can have not only on that person, but their family as well. I feel as if it is important to open up the possibility of human euthanization under strict laws and guidelines in order to give others a better quality of life. I will first begin by explaining the definition of euthanasia, as well as some real-life examples. I will then go into the illnesses and cases that euthanasia is used for. With that being said, I will then explain the reason of why some people choose euthanasia and the positive effects that it not only brings them, but their family. This will be presented in a context using Monroe's sequence as the organizational structure. I will first inform you about the true definition of euthanasia. Euthanasia is a problem that needs to be presented and legalized in order to help better the lives of everyone around us. Euthanasia is the assisted suicide of a patient performed by a physician. Euthanasia is illegal in the United States, according to Margaret P. Batten. Assisted suicide can help aid in the bettering of the quality of life for those suffering from a deteriorative and debilitating disease. Although euthanasia is not legal in the United States, it is legal in Germany, the Netherlands, and other European countries, as stated by Funat Odunku from the University of Munich, Germany. I will now relate this to a real-life physician-assisted suicide case. Many physicians have performed assisted suicides, whether they were legal or not. One doctor, by the name of Dr. Cox, illegally agreed to a woman's request to end her life. The woman had many debilitating psychiatric diseases preventing her from living a good quality of life. She vouched for assisted suicide, where a physician agreed to perform the suicide process, which was performed illegally. She was able to die at peace with her integrity still intact, according to euthanasia.org. Another woman, named Karen Ann Quillen, inspired the Right to Die movement. The Right to Die movement was inspired by Karen's 10-year death that everyone knowingly knew she did not want. Karen was in a permanent vegetative state on a ventilator and life support for 10 years until her life ended because of pneumonia. She was denied the right to die over a dozen times over those 10 years. I will now discuss the importance and benefits of legalizing physician-assisted suicide and the negative effects that not legalizing the act of euthanasia can have on the ones who are suffering, their families, and the physicians who do what they think is right by choosing to help these people. If assisted suicide continues to be put on the back burner, the lives of so many will lack the quality that they deserve. Without legalizing euthanasia, so many people will have to suffer and live an unbearable life, putting a huge challenge and burden on their loved ones. Many physicians see it as their duty to help better the lives of those around them, especially within their care. Doctors are to take an oath to provide the best possible care to patients and are punished for doing what they promised to do. Ending someone's life should not be viewed as a negative thing when it is an act of physician-assisted suicide. Physician-assisted suicide is used to better the lives of many. It gives people a peace of mind and lessens the fears and worries that come with dying from an extremely painful or debilitating disease, according to Megan Jane Johnstone. Physicians want to do what is right by their patients, even if what is being done is illegal, according to euthanasiaprocon.org. Ending someone's life with the right laws and restrictions made to physician-assisted suicide, it can bring about a huge change and betterment of not only the patient's life, but everyone involved in their lives as well. Fears, worries, and the loss of precious dignity can cease to exist with the ease while providing an alternative to die at peace. Those within their last stages of life should be able to die with dignity when a quality of life is no longer in existence. Euthanasia should be used to aid in the death of those who want to end their suffering. Every single person is faced with the fact that someday they will die. If someone is suffering and in pain with no quality of life left, shouldn't there be a way to help better the lives of those people by supporting and legalizing physician-assisted suicide? It is our duty as human beings to think about others, especially during the end of their lives, and make a change. I want you all to realize the benefits that come to those who are helped by physician-assisted suicide, and help support and legalize the act of euthanasia. Just think about this. When you have an animal that holds a very close place in your heart and in your life, and they become ill, and they become riddled with a disease that cannot be cured or reversed, what do you do with that animal? Most animals are euthanized, or in other words, put down to be put out of their pain and misery because they do not deserve to live in a poor quality of life. So why do we prohibit humans from enduring the same pain?